Hey Dave, I'm getting a little fed up being inside all winter.
I think we should go some traveling, and I think we should play some music that emanates traveling tunes.
Yeah, let's do some road trip hits.
I love it. That's right here on KSJE next Sunday, starting at 11 o'clock.
11 o'clock, the wake-up call, KSJE 90.9, 1033. 11 o'clock on Sundays, the wake-up call.
The wake-up call.
KSJE is supported by the Farmington Civic Center, bringing a full slate of entertainment to Farmington and San Juan County. Todd Oliver and Irving the Talking Dog, Monday, March 7th at 7:30 p.m. The Farmington Civic Center, 200 West Arrington in downtown Farmington. Find out more online at fmtn.org/shows or 505-599-1148. KSJE is supported by the University of Denver Graduate School of Social Work, Four Corners program. Proud to offer a Master's of Social Work degree in the Four Corners community. Application for the 2022-2024 cohort is open. Classes are taught Fridays and Saturdays in Durango. Find out more by emailing janelle.doughty, D-O-U-G-H-T-Y, at du.edu or at du.edu/socialwork/Four Corners.
Good morning, everyone. I'm Megan Cullup, along here with Scott Michlin.
Good morning, Megan Cullup.
Hey.
I'm Scott Michlin.
Hey.
Good to see you.
Good to see you.
Happy
I almost
Friday.
forgot to say my last name there.
Wow.
So I stammered.
Well, that's it, but you didn't.
But I didn't.
And you're back. And
Here
you're
I
here.
am.
And here
Yes.
we are, everyone.
Yes.
This is our COVID-19 Community Information Program, everyone. So thank you for joining us. We're going to get an update this morning from Dr. Bob Underwood from San Juan Regional Medical Center. So we're looking forward to that. And we, as we always do, at the start of every program, we kind of talk about the cases and where things are headed.
Yes.
Yeah. And so 2 weeks ago, we were here.
Right.
With the big drop.
The big plummet.
Right. And this was San Juan County, right? This was as of February 7th. Any predictions of what it's going to look like this week, Megan Cullup?
The curve will finally flatten.
You think
or
so?
I guess flatten again, because we've had some flattening here and there.
Right. I don't think it's going to, well, I already know what it's going to do because I made the graphic. But, yeah, it has fallen even more so.
Right.
This week.
Right.
So we're not flattening yet. But
Okay.
we're still plummeting, which is still good.
Which is
cases are still
better
coming
than
down.
flattening in some
Correct.
ways.
So this is again, as we look a little bit of where we are, we're lower with the average cases than we were back in December. We are closer to maybe where we were over the summer in July, when things were kind of flat.
Which is awesome.
Yeah. So, go
I
us.
see that. Yeah. I see you're going to point.
Yeah.
Yeah.
Just pointing at the thing, so you'd see it. But anyway, there you go.
Cool.
So. Good news. I think it's good news. That's why we brought Dr. Underwood on the program to talk about it, to see whether or not it really is good news. And, of course, we know that there's always a delay from the case numbers to what we see maybe reflected at the hospital. And so that's another reason why Dr. Underwood is with us this morning, and he is standing by. I believe he's on the phone this morning. Dr. Underwood, are you there?
Yes, sir, I am. Hello, Scott. Hello, Megan.
Good morning. I think you had to call in twice today, so we apologize for that. But thank you for being persistent.
All good.
We appreciate that. So we were looking at the numbers here, and of course the curves are dropping, and we're hoping that you're seeing similar signs at the hospital with your case numbers and patients and things like that. What can you tell us?
Yes, as a matter of fact, we as of today we have 23 patients in-house. That's combined between those who are waiting for tests to come back and our test proven to be COVID positive. We have one of those patients currently on a ventilator. And we have not been at 23 in-house since we took a little dip back in September. And prior to that is, as you were saying, it was July, August. Since we've had that few a number of COVID patients in-house.
So this is significant, is what I'm hearing you say too.
Absolutely, and we're ramping down a lot of our COVID activities, from daily meetings to check on supplies and ventilators and staffing and all of those things to twice a week right now. And we're anticipating, should we continue on this pathway, that next month we'll cut back even further in terms of how often we need to meet.
Wow.
And this is...
I'm sorry, Dr. Underwood. I was going to say, there was for a time you all were meeting, I think, daily, weren't you, with your planning committees and things like that at the hospital?
That's correct, even weekends.
Yeah. So this is significant.
And it is. It's and that wasn't very long ago. That's how fast this thing has kind of peaked and come back down the other side. If you guys remember, right around Christmas time, mid to late December, we had 100 COVID patients in the hospital, and more than 30 of them were ICU level patients.
Wow.
Yikes.
Yeah, we do remember those numbers
Right.
and those times. So it has happened fairly quickly, and the numbers and the graph kind of shows that as well, just how quickly things have dropped off, as we showed earlier in the program. But just since, as you can see, the peaks there, maybe, mid to early January, and then down to these very low levels that we're seeing today.
Yeah, absolutely. So the community numbers, especially with this Omicron wave, did not affect the hospital as much, even though there were many more positive cases within our community. We never got but to maybe about half of what we saw with the Delta wave as far as illness in the hospital. So lots more people infected, but the acuity of the infection was significantly lower than what we saw with Delta. So those are some of the things that, and I think when we spoke before, that was our hope.
Right.
And those were the reports that we were getting from around the world was, hey, this Omicron is coming, but we're just not seeing people get as sick with it in general. Does it mean that there was nobody sick from it? No, that's not what it means. Nonetheless, it does mean that it really kind of prevented a crush on the hospital and healthcare systems that we feared might happen. So that has truly been a benefit of this last and most recent surge.
That's great news, and I see sort of a pattern here, and I'm going to ask for some predictions, even though there's an unpredictability to this thing. But it seems that the pattern is in the summer months things are better, and even in the early fall in September things were better, and then things got worse. And so, can we expect this thing to be pretty seasonal in the future?
I hope so, and yes, Megan, my crystal ball says no. That I think that you have a point, and it has to do with the fact that it's a respiratory illness. And so one of the things that we find is when people are outside and, of course, atmospheric conditions, that, if the windows open, there is less of an opportunity for high concentrations of viral particle to be able to confer disease to other people with most respiratory infections. That's kind of how it goes. This is a respiratory infection. So would we hope to see that pattern? We would. Can I guarantee that it will be that way? No, I don't think anybody can. And one of the things that we said is anytime we've tried to really predict it fully, we've been wrong. So, but I do think that what you're suggesting scientifically makes sense, and it does seem that it may kind of follow that pattern. So let's kind of hope so. And, like I said, we do see that with other respiratory diseases, influenza being one of them.
Very true. And Dr. Underwood, I know, I think a lot of folks are grateful and happy to see these numbers going the way they are, and we're seeing, of course, a lot of restrictions and masking rules and mandates going away, and people just having the option now of wearing a mask when they're out and about and things along that line, and even in our state in New Mexico. And so this is kind of where I felt we were back in July of last summer, but then we had another variant come along. I'm not hearing a lot of news about any other variants that are maybe in the pipeline, so to speak. I know there's always stuff out there. Is there anything that you're hearing about that may come up and just kind of mess up these things as we try to reopen and get back more to a pre-COVID lifestyle?
The most recent variant of concern is actually related to Omicron. And so the Omicron that we've just gone through is a BA1, is part of the differentiator, and what they're calling this one is BA2. It may be a little more contagious, and we also don't know that if you have had the vaccine or if you had the last round of Omicron, are you protected, which would mean that it really wouldn't be that much of a surge. It would maybe start to slow down the decrease, but not really cause another bump in it. But there is no other, from the research that I did, and I was just trying to look that through earlier this week, no other variant of concern that I am aware of right now.
Okay.
Hey,
I'll take
that's great.
it.
Yeah, exactly.
And we have that on tape. Dr. Underwood.
We will repeat that next winter.
Well, yeah, like I said,
as of today,
I made sure, that I am aware of right now. And so, two caveats in there is, one of them is that I'm aware of. There may be other people that are. So, but we're paying close attention to it. We're in the process right now of writing a bunch of after-action reviews. These are the things that we did when the surge was really bad, so that we don't have to go back and try to reinvent it if we do go through this again next winter.
Right, that makes sense. And so, a follow-up question to all of this, given we're talking about different severity levels and the way things are contagious, at what point, if ever, will this virus become sort of very in line with other not novel coronaviruses? Like, in other words, are we going to be able to relax precautions even more at this point? We're not required to wear masks any longer in public, and are we just going to go back to normal sick precautions? You wash your hands. If you're sick, you stay home, and maybe less of the quarantining that's going on, or are we going to always be stuck in this cycle?
For right now, I think that we're probably in the cycle, and a lot of that is reflexive, the kinds of things that you spoke of. For example, for the most part, coronaviruses, they're very, very common in the world, and they don't usually cause as severe a disease. Now, if we see a coronavirus variant that has the death toll and severity that we saw with Delta, then yes, we'll reinstitute all of those things. But if we have one that really just doesn't affect people to the illness that the Delta variant did, then we will probably stay with limited amounts of precautions. And so it really is just, we have to wait and see. One of the things that we've talked about in the medical community is, okay, we had Omicron, which is very, very contagious, but the acuity wasn't as bad. What happens if the reverse happens? What if we end up with one that is very, very contagious, but that makes people even sicker than the other ones? And so do we think that's going to happen? No, there's no prediction of that, but we need to be ready in case something like that were to come along. We want to be prepared. And we have, as you guys know, done a lot around preparation and contingency plans and things like that, and we want to have all of those lined up so we can ramp right back up where we were if we need to do it. So, the other thing that we're seeing is, although our COVID numbers are down, our hospital is full. It's kind of what we saw last time, is as the COVID numbers started to go down, patients started coming back with other types of illness or care that they had deferred or had been deferred during the big outbreak. And so I think we're going to see that as a continued pattern at the hospital. If it is down, all of the other acuity and all of the other medical care is going to come right back and kind of take its place. So.
Gotcha. Interesting. Well, and speaking of the hospital, Dr. Underwood, I wanted to ask you a bit about the recent announcement that your crisis standards of care has been rescinded at the hospital. So I guess despite the fullness with other types of patients, because of the COVID patient decline, you're able to, I guess, maybe get back to a bit more of normal operations at San Juan Regional Medical Center?
And that's absolutely correct. That's exactly what we're talking about when we say we're not in crisis standards of care. It is the mix of patients. Of course, when we were at crisis standards of care, when we declared it, is when we had more ICU level of care patients than we had ICU beds. And so, or had ICU licensed rooms. And so we were caring for those in other parts of the hospital, which were not typically for that level of management. And that's why we declared it as crisis standards of care, with the key words being standard of care. That we weren't caring for somebody that would normally have been in an ICU in the setting that would have been optimal for an ICU patient. But, part of the crisis standards of care was also that everybody in the state of New Mexico, in fact, the surrounding regions of the United States, were in the same capacity. In other words, normally when we get to that capacity and we don't have the room that we would normally put somebody like that, we'd put them on a helicopter and we fly them to a hospital that does have that, but nobody had that capacity. Everybody was more than 100% during that. So that's why it was declared as crisis standards of care. Now, we still have a full hospital, but the level of care that we can provide is still consistent with a normal standard of care that we would provide on any given day.
That is great news. And let's talk about visitor policy. I've been glued to the visitor policy since this all started, and we know that there's a visitor policy update. What is that update?
So the visitor policy update, of course, for COVID patients, and as I just pointed out, we still have COVID patients in-house, but we have loosened it up for the non-COVID patient, that they can have more than one caregiver or assistant come into the hospital on a daily basis. It's still limited. It's not, I'm trying to remember a term one of our other leaders used the other day. It's not just, all opened up and everybody can come back. It's still limited. However, it's not as tight as it was, because you can have more than one person coming in. We still limit the hours. We're still making announcements of, visiting hours are over the day, things like that. So, but yes, it has lightened up greatly over the course of the last couple of weeks.
Well, that's good to hear, Dr. Underwood, and we are so appreciative of your time throughout the last two years as we go, for always being available. We are probably going to be easing out of our COVID-19 program here as things get better, but bring it kind of out, be ready to bring it back at a moment's notice, like we've done, if needed. But everyone at the hospital has been such great with their time to join us, from the doctors to your cleaning staff to you and to everybody.
Everybody, yeah.
Right?
We really brought in...
We went through the roster,
We did.
I think, at the hospital over the last 2 years,
Yeah.
and had a lot of good information on the air for everyone to share with. So we really appreciate you being here this morning as well.
And I've said this to you guys before, that's mutual thanks. At these times, it's just so important for our community to hear what's really happening at the healthcare facilities. And so thank you for giving us a venue where we can share that important information with the public. And that has been great. And of course, I'm still going to take the time to thank every caregiver at our facility. The work and the stress, and we don't know if it's completely over, but the work that they have done to care for this public has been just stellar and heroic, and we don't understate that. It is amazing to see these folks and to come back and do it again, because they care about the people and they care about the community. So thank you to all of the people that work here at the hospital.
Most definitely, and I think the community has shown that time after time as well. But we appreciate you, Dr. Underwood, and don't worry, we haven't lost your number. So you may get a call that we want to talk to you about gallbladders or something. So
who knows?
Be ready.
Absolutely.
All right.
I'll always available for you guys.
Thank you very much.
Yep, you bet.
That's Dr. Robert Underwood, Chief Medical Officer at San Juan Regional Medical Center. Always a pleasure to have him on the show, and he's always been available when we called.
I know.
Even when they were meeting 7 days a week.
They were meeting every day, including weekends, and yet all of our hospital guests
every
took
time we
30
reached
minutes
out
of their schedule for us.
I know.
Yeah.
And it's us.
I know.
So there's that too.
Even more impressive.
Right.
Yes.
Exactly.
Yes.
So anyway, we really appreciate that. But yes, we have decided that we'll probably put this program on hiatus since conditions are improving, and I think, we're all ready to maybe move on. But obviously, if things do come back and we see the numbers coming back up, and we're having to share more information about COVID-19, we're ready to do that as well. We've kind of learned how to pivot, if you will.
Right.
There's a term we've used a lot the last 2 years.
Yes.
And so anyway, it'll be there, but we'll come up with something else to put in this spot.
We are working on it. It's percolating.
It is. It really. Wait. It's
Yeah, exactly. That too, but whatever.
Gesture. Yeah. But there you are. So stay tuned because it'll be great. And of course, our Solutions from the Street will be here next week.
That's right.
And we'll keep doing that. That
More
doesn't
solutions,
change.
more streets.
That's right. Very true. So as we wrap up today, though, we want to share again more important information about COVID testing. Again, we shared this last time that there is a new location in Bloomfield at the Bloomfield High School North Gym parking lot, because I think as we do move forward, maybe the vaccines, hopefully everyone will be vaccinated that wants to get vaccinated, but the testing is going to be the important component of this, right?
Right.
To learn if you are sick, and then if you do need to quarantine, because we know how contagious this is in the early days of it, right?
Right.
So the testing, I think, is important to keep sharing. And so anyway, Curative has a site at Bloomfield. They are open, again, weekly on Wednesdays in the Bloomfield High School North Gym parking lot there. We also wanted to let you know about a new Embry Health testing site in Aztec,
Right.
outside of the Timberline Church on Ruins Road, 311 Ruins Road in Aztec, New Mexico. And again, they're doing the tests Monday through Saturday, 7 a.m. to 7 p.m.
That's nice of them.
Yeah.
That's a long time.
So they're there, again, and the results are 1 to 3 days. So that's the Embry Health testing site in Aztec. The other Embry Health site is here in Farmington, outside of Riverstone Church. They're on North Monterey, kind of around North Butler, that area of town. And so they are open, again, Monday through Friday, 9 to 5. So that's that testing site.
Yep.
So that's there. The rapid COVID testing site, because I think some folks are looking for maybe, do I want to get a result right away or not? But rapid PCR testing is back at the Old Tibbetts Library. Megan's favorite place to get tested, I think, is the Old Tibbetts Library.
The Old Tibbetts Library.
Right,
It's no longer a library.
It's not a library, and it's no longer Tibbetts.
Just a building.
It's just sitting there, right. At 304 East Apache, but it's a Curative site open Monday through Friday, 8 a.m. to 6 p.m., and so that is available for the rapid testing that I know some folks just want to know within a few hours, right, of
Right.
what the situation
Sure, yeah.
is. Aztec is still doing
going.
their testing Wednesdays and Fridays, 7 to 3 at Fred Cook Stadium over in Aztec. And then, of course, McGee Park, the granddaddy of them all.
That's true.
That's been here for
Yes.
2 years. COVID testing there Monday through Friday, 8 to 3. And then we still have Farmington Schools at 30th Street. Monday, Tuesdays, and Thursdays are their testing times and days. And so they're doing that as well. And of course, more information about the vaccines can be found online at vaccinenm.org.
That's right.
So I know our health folks are still encouraging folks who maybe haven't gotten vaccinated or maybe didn't get the booster or what have you to consider doing that
That's right.
as we move forward. So that is our program. How about
Whew,
that?
yeah.
Right?
Man.
Lots of information still.
Still.
It's still with us.
Yeah.
And here we're coming up on 2 years.
I know, but how wonderful where it is now, right?
Oh, yeah.
I mean,
Definitely.
we stuck it out together.
Yes.
There was some dissension
Really?
constantly, but
Really?
yeah, but
Well,
still,
Thank you for seeing my point
yes,
every time.
yes,
No, we had a good conversations.
yes.
And I think we've had a good, a good venue to share information. Again, the point was to make sure that we could put this on the radio so you didn't have to subscribe or pay. This was information that should be free to the community, and it wasn't based in Albuquerque. It wasn't based in Santa Fe. It was stuff that we thought San Juan County folks needed to know.
Right.
And that's why we did the show.
That's why we did it.
And we'll bring it back.
That's
and
right.
we're going to keep doing locally important programs as well in this space.
That's right. Yes, the space is still hollowed out for
Yes.
important local programming.
Exactly. So thank you for your commitment the last 2 years.
Yeah, it's been real.
Because it started 4 days a week. Remember that? You were here 4 days a week.
I
with me.
remember with you.
I know.
But that was
that
like,
deserves
you were the
some
only
kind
person
of
I saw.
certificate. That's right. But you were home alone.
Yeah.
The rest of the time.
Yeah.
That's true.
So
Yeah.
we've come a long way.
We have.
And we thank you for being with us as well, audience. So thank you for being with us. Again, we invite you to share this program if you find the information helpful and useful with your social networks. It's on Facebook, it's on YouTube, it's on Twitter, and of course it's a podcast wherever you listen to podcasts. So check it out and share this information. But we thank you for joining us, and we will see you next week for Solutions from the Street.
That's right.
So there you go, everybody. Have a great week, everyone. Stay well and stay safe. Bye-bye. KSJE is supported by San Juan Regional Medical Center, a community-owned and operated hospital. Here for you when you need us. From emergency care to routine checkups and screenings, caregivers are here and ready to provide the safe, high-quality care you need close to home. Online at sanjuanregional.com with the latest health information and resources to help you live life better here. KSJE and San Juan College present the Student Success Coaching Tip of the Week.
Hello, this is Emin Chi from the Student Achievement Center. This week we're bringing you coaching tips of the week for week 7. Taking good notes. Studying starts in the classroom. Pay attention and take good notes. So when you're studying later, you're just reviewing information. Speak with your professor about recording lectures on your phone. A recording can complement your notes so you can go back and re-listen to the information in case there are other details you pick up on later to note. Effective note-taking strategies can have a direct impact on your study habits and is one of the most important study tips for college.
The Student Success Coaching Tip of the Week, presented by KSJE and the Student Achievement Center at San Juan College.